Good evening. I'm Dr. Basil Considine. I'm here from the ACU Online Writing Center, and today we are going to be talking about how to use classical rhetoric when making an argument about ethics. Now, if you don't know what the term classical rhetoric refers to, don't worry, we're going to cover that. But we're going to drill into some ways of understanding the types of arguments that we make that have been recorded for thousands of years and continue to be studied and taught because they really get at to some of the they really get at some of the fundamentals of how we understand what makes an argument effective in a particular situation and with a particular person or point of view. If you're new to the Online Writing Center, we have appointments available for two different channels. You can make email or asynchronous appointments where you upload your paper and we send you feedback generally within 24 hours. If it's, say, Easter Sunday, might be a little bit longer, but we'll get it to you before well before the paper deadline for sure. And we also have Zoom appointments where you can meet with someone in real time. You can make up to 2 appointments per week, availability permitting, and you can schedule appointments up to 2 weeks in advance. So if you know that there's a big paper that you want to get some input on, go ahead and check your calendar and sign up as soon as you can, and that helps guarantee that you're able to get the input you're looking for to do your best. All right, we're going to be looking here at first the four principal types of classical rhetoric, and then we're going to look at a discussion board assignment and how those might come up. So, what do I mean by the four principal types of classical rhetoric? Well, if you look back about 2,500 years into the classical Greek antiquity, you have these philosophers and authors, rhetoricians, of which names like Plato and Aristotle are still well known today. And there was a lot of discussion about what the world was, and where you would have different city states and different people within them making arguments about things like, oh, what should you do when you are faced by tyranny? What should you do when a overwhelming enemy is threatening you? And from this, they developed a whole wide body of literature about what the right thing to do was in different situations. And they did not always agree. And you had city states going to war sometimes because of their differences on fundamental principles, things that perhaps within that city state a group of people took for granted. And then they had to recognize that people did not always agree. And so you made different types of arguments, try and convince people. And from this coalesced an understanding of these four ways of classifying them. And so the first of these is ethos. Now, it's tempting to look at ethos and say that sounds like ethics. And that is true to a point. But rather than uh, fixating on that word, let's for now say that the argument made with ethos is one that is trying to express a certain worldview or purpose or view of things. Pathos, on the other hand, is an argument that is based on emotions, on feelings, which, as anyone who's ever been in a romantic relationship, I think, might agree, uh, feelings are big, important things, and they might not always be right or rational, but there are things that we need to understand, appreciate. Logos. So this is an argument that is using evidence and reasoning. Logic is the word that comes from logos, and that is a good way to think about it. Not necessarily like Spock on Star Trek, logical, emotionless, but saying that we're trying to look at cause and effect and say, oh well, because of this, the other thing. Now, kairos is a thing that I think many people learn later in life is very important. The importance of timing or timeliness. And we'll go into more examples for all of these. But these are the four principal types of classical rhetoric, of ways of making an argument. So, what do I mean by rhetoric? Well, you could define it as effective or persuasive communication, or use it more specifically to refer to that specific language or phrasing that you are using to convince your audience, whether that's a person listening to you, someone reading your writing, or someone that you are otherwise communicating with. And rhetoric isn't entirely verbal. There are many things about presentation, especially in the realm of diplomacy, that matter beyond words. But in our case, we are going to be looking at word-based rhetoric. So let's take a look at ethos. Now, ethos is the root from which we get the words ethics and ethical, so they are related. But the, I think, better way to understand what ethos refers to is that you are making an argument with ethos when it's founded on a claim that this is how things are, such as if I say, you are a bad person. Notice that's not inviting any sort of subjective interpretation. It is just declaring this is a fact. You are a bad person, or you are a good person. And this refers not just to something like that, but statements of values like, oh, it is good for children to be respectful to their parents. Or, in a slightly lighter vein, Pomeranians are the best puppies. Now, I don't know what your thoughts about uh, dogs are, but if I make the statement that they're the best puppies, I'm declaring that that's the case, and I'm just stating that is how things are. I'm not saying they're the best puppies because they are so cute and fluffy. I'm just saying they are the best. And similarly, stealing is wrong. And that is a statement that a lot of people would agree with. But, that it is at its essence a statement of this is how things are. Now, if we had a statement that was something more along the lines of stealing is not a good idea because you will go to jail, that's a more logos argument. That's talking about logic and cause and effect. But just declaring that it is wrong, that is a statement using ethos because it's claiming this is just how things are. So, logos, this is where we get the words logic and logical. And so, this is an argument that's founded on reasoning, showing links or cause and effect. Like, oh, you don't like painting, so you should stop paying for your painting class. If this thing, then the other thing follows logically. Or you say you want to break up with your boyfriend, so you should. That's saying, oh, well, the next step in this process is you've laid out that you want to break up with them, so why are we not? Now, contrast that with pathos. Pathos is emotion-based arguments. And I say not in the like irrational emotional sense, but saying that feelings are of central importance in giving the argument power. So, for example, if I say your mother hates me, it's a little bit of a ethos statement, and it's declaring this is how things are. But even stronger than that is that emotion. Your mother hates me, or I love someone else. This is something that is hard to counter because emotions often override other things. Or chocolate makes me happy. It's not really something that uh, is subject to change easily. If chocolate makes me happy, what would it take to get me to not like chocolate? That's hard to change. I love someone else. That's also not easy to change, as the testimonies of many people who are in a relationship and then say they want to get out of it because, oh, I fell in love with someone else or I fell out in love with you. It's not something that is easy to create or dissolve. And that is one of the one of the things that makes a pathos based argument strong and also may make people dismiss it because they may say, well, it's irrational. Look at this other stuff. That is what you should be doing. Like, oh, you've invested so much time in this relationship. Why throw it away for something you don't know? And then the person who is in love will make a pathos-based response to it, but I love them. Now, kairos, this is the one about timing it. So you might understand this as what's appropriate or timely, or an argument or statement in which the timing or circumstances are of the greatest importance. Like, we should leave this house because it is on fire. Yeah, without that thing, we should leave this house. Well, why? I like this house. It's comfy. It's warm. It's got air conditioning and food and stuff. Oh, it's on fire. Yeah, that trumps all of the other things. Let us get out of the house now. Or, I need to leave now, or I will miss my bus. And yes, there's a little bit of overlap with the logos with cause and effect, but it's that I need to leave now that is giving the argument its greatest weight that makes this a kairos argument. Or we should eat our food before it gets cold. Now, if that I was saying, you should eat your food before it gets cold because the last time you ate it and it was cold, you said it tasted disgusting and that made the cook unhappy. That's crossing into a number of other things. So these are not mutually exclusive. There can be a lot of overlap between them. But for understanding what the greatest part, the thing that's giving this the most weight, uh, in each of these statements, as we see them, it's the timing or circumstances that make it most important. So let's take a more light-hearted look at this with how to write an effective breakup letter using these 4 different types of argumentation. Dear Genevieve, we should break up. Here are some of the reasons why. First, your mother hates me and I don't like it. That's pathos. Also, you are not nice to me and I want someone who will treat me better. That's logos. Being single is great. That's just a statement I'm making, saying this is how things are. That's ethos. If we break up now, I won't have to get you a Christmas present. Ah, well, hopefully that's not the main reason they're breaking up, but that's definitely a kairos argument about the timeliness. Therefore, I don't want to see you again. Sincerely, me. Well, hopefully you never get a letter like this, but because they're making their argument in 4 different ways, it is kind of hard to disagree with. Because even if there's one of those that like insist, my mother doesn't really hate you. 2 through 4, it's harder to dismiss with that one disagreement. So you'll find that often people will make an argument that has more than one of these types of rhetoric to give it greater strength and to make it more convincing. So again, ethos, that's about a statement about how things are or how you perceive the world. Logos, it's an argument about using logic, cause and effect, reasoning. Pathos, where emotions are of great importance, emotions and feelings. And kairos, where the timeliness or timing is of great importance. So let's take a look at this discussion assignment. And this is a discussion assignment about a topic that is very important in our society, about opioid use in prescription pain management. And so this is coming from a NURO 338, our Pharmacology and Pathophysiology for Practicing Nurses course. And if we look at this, this is how it is captured on the assignment website. But let's break this down into different sections and understand that this is telling us first a preamble. Okay, why are we doing this? Well, to reflect on a patient scenario and apply your knowledge learned so far about a legal and or ethical issue experienced with acute or chronic pain. Now, going back to the types of rhetoric here, as soon as you're interposing the distinction acute or chronic, that starts bringing in questions about, are you going to make a kairos-based argument? Now, before we delve later, just imagine if we had a really super powerful, super addictive pain management drug. I'm not going to name names, but you can probably think of some. And imagine that this is going to make all the pain go away, but has a 90% and addictiveness. Are we going to use this at all? Is it worth using something that has such a high potential? That's starting to get into the area of ethos. If it's something where there are factors that can be controlled, you might be looking at logos. If you're making an argument saying, no matter what the addictiveness, the patient not being in pain is important because the idea of someone being in pain and hurts me and hurts them, it's going in the pathos direction. If it's something like, oh, well, they were just in a motorcycle accident, we're giving them for this, but we wouldn't for chronic management, then you'd be talking more a kairos-based argument. So acute or chronic pain, that's going to have a significant impact on your argument. Same thing with, is this legal? Are we talking about what the law says, or are we talking about what you believe or understand or agree is right, which would be the ethical side? Now, laws and ethics often overlap, but it's not necessarily true, especially if you believe that a law hasn't kept pace with actual usage of society. So let's delve into the discussion instructions here. Discuss a legal and or ethical issue you have experienced in your practice with a patient who has either acute or chronic pain. How did you handle the administration of opioid or non-opioid medication or treatment? And were there any cultural considerations you could discuss? So we are reflecting back on a prior experience and asking, well, okay, what happened and why did that happen that way? So you might break this down as you're thinking about what to respond and ask yourself questions like, well, why did you handle this the way that you did? What was your instinctual action? What was your internal reasoning? And what would make you change your mind? Now, I'll give you a anecdote from my own experience. So I have worked in the past with many patients who have sickle cell disease, and when they have an acute chest crisis, it is exceedingly painful, and many of them come to the hospital to manage this with morphine. Now, morphine is highly addictive. It's not the most addictive drug out there, but it is highly addictive. And many of these patients know that and are trying to actively limit their exposure. And so spacing it out so they're not getting too much, just trying to get it low enough so it's a level that they can deal with. And, this is dealing with a chronic disease. Sickle cell is really only curable by bone marrow transplant, and it's uh, something you might wait for years to get a suitable match. And then even then, it's not without risks. And so how does that vary based on how you might treat another patient? Because we sometimes do have patients walk in who say, oh, my toe hurts. It's terrible. It's 10 out of 10. Morphine, please. And you're like, ah. So is there something about the timeliness or the person or other aspects that might affect that? And what would make you change your mind about this? I know that the first time that I learned that acute chest was being treated with morphine, I was very worried. And, it's not something that these families usually enter into lightly. But, when I'm working with a patient who is, say, 20 years old and they're just trying to get the pain down enough so that they can sleep, so that they can make it to work or make it to class the next day, that is definitely something where uh, you feel for them and you want to help them succeed at things, and also want to help them resist having to go elsewhere for really terrible pain management. And so what you do in that environment and why you do it is absolutely something you can write about. Now, that question about cultural considerations you could discuss. So this is getting back to a little bit about the ethos. Like, what is the way that you view the world or how you understand things? Like, what are those principles? Because there are people who their beliefs do include, oh, X is wrong or X is not for me. A classic example might be a religion that has views on scientific medicine or herbal medicine that may be completely different from what you believe and understand. And so, when asking this, well, what are the major influences on how you view the world? And in contrast, what are the major influences on how your patient views or viewed the world? And what do you do if there's some differences there? I I will say I have had patients come in and they demand opioids, and sometimes they seem to be, uh, we'll say, a opioid seeking rather than having a condition that you can recognize. But that's not always something where you can work with perfect certainty. And so this is where your views on someone and on the treatment may have a guiding act in the absence of other information. And that's really something that healthcare providers need to wrestle with because you do not want to be governed by your prejudices and stop people from receiving the care that they should. And by extension, that also means you don't want people to receive care that they shouldn't, like things that will cause them harm. And yeah, the pain management epidemic is one of the great challenges of our time in the United States. So this is something where a lot of people are wrestling with it. It's okay if you have unreconciled thoughts. If you have mixed thoughts about it, tell us about this. If you are uncomfortable with something that you saw in your beliefs, your behavior, your initial reaction, that is something that is good to discuss. We don't expect our beliefs to be static for our whole lives, and circumstances change. So it's natural to understand that our beliefs do as well. So it's something to consider as we're doing this, and absolutely something you can and should write about. Now, before we wrap up, let's just briefly jump back to those types of rhetoric. So, as you are exploring your own belief, it might be helpful to ask, well, what are the things that I just believe this is how things are? And how does that influence your approach to that? Um, I personally will believe that all patients are um, worthy of good medical care, and how we deliver that with all the imperfection of our society, that is a challenge. But I would say, for myself, that is one of my ethos statements. All patients and deserve good care. Um, what that means in practice, you know, that's harder to work out. For logos, for argumentation, I can point at things and say, oh, yes. So here's what the law requires that we do. Like when a patient presents in the emergency room, um, you are required to offer them treatment regardless of ability to pay. There are good things about that. There are bad things about that. There are lots of challenging things about that. Pathos, emotion. You know, we have patients who show up and they believe really strongly that the things that they are feeling are in need of treatment. And, I've worked in the pediatric emergency room enough to have worked with parents who were freaking out because this is their first time being parents and they needed some reassurance. They needed perhaps a little education. And, once the doctor had weighed in and been able to reassure them that no, this is actually not something that is wrong, um, uh, they were able to go back to being parents and do all the things that that entails. But those emotions were very real. And, you don't want to create a problem because you feel so strongly that you jump to over treating. If it's just a minor bit of gas, it would be a shame to give someone laxatives, to pick an extreme example. It's generally not merited as ed for someone just having a little bit of intestinal upset. And the same thing about kairos. You might wait in the emergency room and you're like, okay, that's no longer a problem for a variety of reasons. Or you might wait in the emergency room and, oh, now it is really a problem. Timeliness has a huge impact, and that is something that, with pain management, one of the reasons we struggle with it is that you're trying to calibrate the dose effectively. But if you give someone too much of, let's say, a NSAIDs, well, you can damage the kidneys, you can damage the liver, and that is not a good response to trying to avoid giving someone a highly addictive medication. You don't want to injure something that doesn't grow back and regenerate, and even if the kidneys do, it's rather terrible to have acute kidney injury because you gave someone too high a dose of a medication when it was appropriate to escalate to something else that had downsides but would not damage your kidneys that way. So I hope that was helpful at looking at this. And remember, the goal of this is to reflect and to apply the knowledge that you have. It's not to have the perfect argument for everything, because we are learning and patients are as diverse as there are humans in the world. So, hope that was helpful. If you have any questions, email us at onlinewritingcenter@acu.edu. You can go to my.acu.edu and select Academic Resources Online Writing Center to make an appointment and visit us online.